I think when we learned the most about that is when we had our 4-year-old get ovarian cancer.
That's right.
You want to like explain a little bit what happened with that?
That was the finally uh-oh moment, where it's not just like I'm having a baby and I'm trying to make some decisions based on the knowledge I have. This was like not territory that we've even want to come close to. So as soon as our child's in pain, there's some things that look abnormal. There's a lump on her side that happened within a few hours. The lump.
She had a tumor in her abdomen,
Right.
the size of a softball, as
Yes.
a 4-year-old.
Yes.
And you couldn't tell.
No.
And then it rolled over, which caused her a ton of pain and made the lump appear in the side
Right.
of her.
And that happened over one day.
Yeah.
One day was when it twisted and it shifted
started
to the
having
side,
pain.
and there was a pain. We thought it was appendicitis or a rupture appendix. And so we took her to the hospital, and then the doctor said, you know, she's got a mass the size of a softball, and we don't know what it is.
Well, he actually said, uh-oh.
Oh, he did.
Yeah.
And so I was like, okay. And once they told us what it was, then we were back to, we don't know anything
Yeah.
in this area. Take care of her.
Yeah, and if you remember too, this was after, so we had transitioned our company benefits to reimburse. This was after the implementation of Obamacare, and it was like our first situation where that was the case. And so we had transitioned our benefits to reimburse, and we, being a young family that didn't have a lot of health expenses, were early adopters of a health share. So if you remember, going to the doctor on that in the early days was like, we had no insurance card.
Mm-hmm.
They would be like, what is this? Are you going to pay?
And would pay cash.
And we would pay cash, and
Yes.
then we would negotiate the bills down and get reimbursed months later.
Yeah.
So do you want to explain like what the process was for trying to talk about oncology, surgery, everything that we were dealing with from that perspective?
Well, every procedure has so many areas of it, so many aspects, from the room you're in, from the equipment they use, the nurses that are coming in and out, the doctor that sees you, and the period of time that you're in there. So you get billed for all these separate things, which is information that's not disclosed or transparent to the patients.
But it can be.
But it can be, absolutely. Just like if you did business with anybody, you would ask, if you went to Walmart and bought some groceries, you get a receipt of everything you purchased. And so this was business that was not transparent. And I'm paying cash, and I'm negotiating the price and saying, okay, well, if I'm paying all up front, what's the discount? What if I pay half? What's the discount? It was a very difficult process. So
Yeah, like everyone looks at you like you're
Right.
speaking a foreign language.
Right, or like you're attacking them. I think more than that too is like that I'm saying you're a liar. No, I just want to know how much it's going to be, because I have to pay it out of my pocket, cash. And so we did that with after surgery, after everything that went down, and that's a big story, but we had treatments, we had labs, we had scans, we had doctor's visits, and all those were separate. And they were also not part of the hospital and part of the hospital. So I'd have to talk to different people about how to pay these things, how to go on a payment plan if I couldn't just fork out $5,000 for a scan. And so there was different things, but also realizing that every time I went in to pay a bill, it could be cut in half.
Lots of times.
Lots of times.
Yeah.
Most of the
We're
time.
like gotten rid of. You know what's
Yeah.
crazy is some things they were like, oh, we didn't have to bill separately for that.
Yes.
But when they're billing an insurance program instead of a nice lady that comes in there and talks to them about it, no one looks at that because it's like, oh, this is allowable under the program, so they do that. But
It's a system, because they're dealing with a system and not a person.
There you go.
So as soon as we take the person out of the picture, we can bill whatever we want.
Yeah. Well, I mean, again, the abuse runs both ways. So
Right.
that's what it's a vicious system, because
Mm-hmm.
if you speak with the doctor about this, they're feeling like the victim.
Yes.
Which is really terrible that you're feeling that way and they're feeling that way. It's like, we could solve this problem, just do business.
Right.
Yeah.
Right. And I think a lot of it goes back to removing accountability for ourselves, not having to be accountable for a bad choice or whatever we did. So it's much easier to say, well, my doctor made that choice, it's its fault. Or the insurance company made that choice, it's their fault.
Yeah.
And then say, I had knowledge of this, I make that choice, it was not the right choice at the time, I guess.
Yeah.
And then move forward.
Well, so after you negotiated the bills, we were like in the high 30,000s for everything cancer oriented.